So we're talking now about what do we use bioidentical hormones for. This question comes up here a lot because most people think of bioidentical hormones as being what we primarily use for women who are menopausal, which is true. That is true. Bioidentical hormones are mostly used for women who are menopausal. However, they have a lot of different uses. Back to the menopausal though, let's discuss that first. So bioidentical hormones definitely are used in women who are menopausal. They help to do a lot of things: alleviate hot flashes, take away night sweats, help with mood swings. A lot of women who are menopausal notice that they have really poor tone to their bodies. You know, they used to be able to work out and get really nice tone, and they can't do that anymore. They notice that, you know, their mood swings are pretty rough, and, you know, they just overall feel pretty horrible. Libido is usually quite poor. So those different things are bioidentical hormones are very useful for. But bioidentical hormones are useful for other things too. Andropause is a good one. So what's andropause? Andropause is actually the male version of menopause. I know that men either like to pretend like it doesn't happen, or they don't notice that it's happening because andropause is very slow and does not happen quite as abruptly as menopause. In men, you know, their testosterone levels trail off, but it takes a lot of time for that to happen. Where in women, you know, their cycles stop and their hot flashes start, so it's very obvious. With andropause, men actually start to notice slowly that they have fatigue. Their muscle tone's not good. They notice that maybe their libido is not as good as it used to be, although none of them ever want to admit to it. You know who you are. And so they notice that kind of all these things are happening, and they just chalk it up to age, which really isn't a fair thing, because it's more than age. It's loss of testosterone. So when men start to lose their testosterone levels aren't as high as it used to be. They start to suffer from a lot of these symptoms. Well, the nice thing about bioidentical hormones is we can use them in men too. So women, we can help through menopause by giving them progesterone and different types of estrogen and some testosterone. Men, we can help with testosterone. And actually, men sometimes do require a little bit of progesterone too. It just depends. But men do rather well with testosterone. A lot of times here in my office, we use testosterone injections, and we give them a few times a week, depending on the man, sometimes 2 or 3, and they do incredibly well. The other things that we use bioidentical hormones for are things like premenopausal issues. So, you know, someone might be perimenopausal and they're starting to have really abnormal cycles where they bleed really heavily, and they're starting to notice that they're losing muscle mass, their tone's not good, their cycles can get really irregular, and it's nice because things like progesterone can really help people, because at that point, we notice the progesterone levels are starting to drop off. Their estrogen is starting to stay the same, or maybe lower slightly, and that's what causes this type of issue. When your progesterone levels first start to slide, it causes the irregular bleeding, the irregular cycles. So progesterone is wonderful for that, for women who are perimenopausal. They haven't quite entered menopause completely yet. Prevention. I think that bioidentical hormones, most importantly, can be used to help women with prevention of things like osteoporosis. Testosterone does this because it helps to build your body mass, and if you have low body mass, you're going to have poor bone density. And so it helps with that. We know that it helps to protect against cardiovascular disease. It helps with dementia. Dementia being, you know, incredibly important. There's been some really good studies that have come out of Europe showing that women who have their ovaries removed, when they have a hysterectomy earlier in life, without hormone replacement, they can actually have dementia that ensues much earlier in their life, which is obviously a horrible thing. And so prevention of dementia is huge. And that's not just for women who've had hysterectomies, it's for all women. And then there are some studies that have come out recently showing that bioidentical hormones help to even out a woman's hormones to the point where we believe that postmenopausal breast cancer risk is greatly reduced. So again, another really important thing to think about when it comes to bioidentical hormones. They're not just for hot flashes, they're not just for night sweats. Bioidentical hormones actually fit an array of categories and help people with a lot of different things.